Hi there. Today's interview topic is women's health, and I am really excited about this one because the questions came from you. We asked our customers to tell us what they want to know about women's health and homeopathy. So be sure you have pen and paper for this one. Quick disclaimer that we are not medical doctors and not giving medical advice. But my name is Carrie Wagner, co-founder of TapRoots, your trusted wellness source for pure homeopathic remedies to improve sleep, reduce pain, lower anxiety, and so much more for babies through adults and even your pets. Please welcome back our friend, Melissa Crenshaw, Certified Homeopath. Hi, Melissa.
Hi, thank you for having me again.
Of course. Thank you for being here. I know Melissa has been helping families find freedom and joy using homeopathy for health for over 20 years. And we're so thankful every time you freely give us your time to share this valuable information. So thank you. Thank you.
You are
As I
so welcome.
mentioned, yes, as I mentioned, we've collected questions from our customers and so that we can share exactly what you want to know about women's health today. And next time Melissa and I meet, which will be in a couple of weeks, we will be talking about men's health. So keep sending us your questions so we can try to answer all of them for you. I have 10 questions today that we've compiled for Melissa to answer about women's health. So are you ready, Melissa?
I think I am.
All right. All right, let's jump in. So
Okay.
the first question is a very common question we get often. What can a woman do if she's lost her libido?
Mm. So, of course, we need to support hormones, obviously, and sepia is the first remedy to think of. It's not the only one. It could be Ignatia or Natmure. But sepia is a great one to start with, and I would do sepia. You could do uh, you could do 200 once a week, or you could do 12C once a day. And I know that's kind of you've never heard me say that before, Carrie, but that because that's not a Banerjee protocol, which is normally what I usually do. But yeah, some people do better on a 12C once a day. So the right remedy is more important than the potency.
Okay, and what would you suggest? How would someone know? I mean, should they try one and try the other, or how would they know which one to go with?
Do you mean between sepia and Natmure?
Actually, I mean, sepia 200
Gotcha.
once a week, twice a week versus sepia 12C, maybe more often.
Just start with one. And so I would probably start with sepia 200 once a week. I love doing that's where I love to just start. And sometimes we increase that to 2 or 3 times a week. Sometimes we increase that to once a day, depending on how the woman is doing. And then sometimes there are it's hard to tell, it's hard to explain here, but then there's sometimes where we see, you know what, this is just too much. Even sepia 200 once a week is too much, meaning maybe there's some aggravations and we go to 12C once a day. You could even do a 6C once a day. I don't want to be confusing, but the potency really isn't as important as getting the right remedy.
Okay, great tips. And I know if you're watching this today and you're new to homeopathy, this is where we'll give you information at the end on being able to learn more about the basics of homeopathy with Melissa. She offers classes, consultations, and today's video is geared more towards somebody that's probably already using homeopathy and a little familiar with what's with these conditions and these remedies. But okay, so that's great. I knew sepia would probably be mentioned several times throughout these
Yes.
questions. So the second question is, how often can you use sepia 200 if your vaginal lining is thinned after menopause or if intercourse sometimes causes either a rawness or bleeding?
That would be the same. I like to start with 200 once a week. And then if you're so here's how to know if you need to increase. Go use 200 once a week for 8 weeks and then reassess your situation. Look, take good notes in the beginning, rate your symptoms on a scale of 1 to 10, and then at the end of 8 weeks, look at your symptoms, what's happening, and keep good notes. And then if you feel like it has helped a little bit and you're like, I mean, yeah, there's some change, you're on the right track. But then you might choose then to go to twice a week. So increase slowly. Or if you just like to hit it hard and go for it and just see what happens, you can do sepia 200 once a day.
Okay, good. And like I said, Melissa offers those individual consultations. So if you're sitting there watching saying, well, I don't know where to start, or you're brand new to homeopathy, you can reach out to her where she can give you an exact protocol after taking your entire case and knowing the whole picture of what's happening.
Absolutely.
So the third question we received from a customer is, what's the best remedy for hormonal headaches, fatigue, and cramps?
Sepia again.
Love it.
It
It's a
really is.
lifesaver.
Yeah. So especially that hormonal headache, sepia, and you can use that acutely. But if you have hormonal headaches every single month or even very often, let's say maybe you don't have it every month, but you've been having them very often throughout the years, then I would do the sepia every week to uproot that condition. You can also use sepia 30C as needed for that hormonal headache. So when you get one, you could take that one a few times in a day to help get rid of the current headache that you have. And then you said cramps, Magfoss 6X or 200C. And so the way to choose is, again, just try one. I would definitely start with 6X in that instance. You could do it dry, and I mean just putting the pellets in your mouth, or you can dissolve those in warm water, just a few ounces of warm water, and sip it, and finish it before the water gets cool. That I've seen really help a lot. So if you're taking Magfoss 6X dry and it doesn't seem to be helping very much, then put it in warm water. I'm seeing huge results with that. And then if you're kind of getting a little results, yeah, I mean, it's okay, but I still have to take Advil or whatever you take, then try the 200 and you might see a huge difference.
Okay. And so if somebody's never heard about dissolving them in water before, would you say that's about 4 pellets in an ounce of water, or how much would you say you're dissolving?
Perfect. Yep, perfect amount. 4 pellets per ounce of water. Um,
Okay.
but and that's what some people say. If you want a recipe, but I would drop 4 pellets in 2 or even 4 ounces of water.
Okay. And then you're just sipping it every 30 seconds or so. Does it matter how often?
Doesn't matter. You just finish it before it gets cold. So put it in a
Okay.
mug. You could even put it in a thermos. If you're having really bad cramps at night, you could put it in a thermos and have it by your bed. And just every time you wake up, take a sip and it'll
Okay.
keep it warm. hmm
Great tip. All right. Talk to us about dry skin and fragile nails.
Oh man, the cell salts. You need cell salts. Nat Mur is great for dry skin. So Nat Mur is a cell salt and it's our water balancer. And so if you're too dry or too wet, no matter where, like if you have really watery eyes, if you have a drippy, watery nose, or if you have very dry skin or very dry anywhere, if there's too much or not enough water, you're going to think of Natmure. And again, it's a cell salt. You could use it in a 6X, you could use it in a 30 or a 200. I absolutely love Natmure 30. And I'm not saying that everybody should do that like I'm telling you to do. I played with it. Natmure 6X was good, but Natmure 30 for me is beautiful. So start with 6X. And you could do that twice a day for a couple of weeks and then go down to once a day. What was the other thing you said besides dry skin? What was the second thing?
Fragile nails.
Silica. So nails is silica and also known as silicia. So if you see that on a bottle, you'll know they're the same thing. So silica we often use in a 12X, and you could do that 2 to 3 times a day. You could also just choose to use Highland's bioplasma, and for all of these things, the hair, nails, skin, it can do all the things. So you could just take that 2 or 3 times a day.
Wonderful. So if you are new to homeopathy and don't know what bioplasma is, it's all 12 cell salts mixed into one. And is there, you said they could do the bioplasma. Yeah, you have it right there.
I do.
Perfect. I love that. I love it. Even in, I especially love that in the summertime when my kids are out in the sun a lot, kind of like making their own little Gatorade drink.
Yep. hmm
Okay, good. Let's see. Next question is, well, we were talking about dryness. Can you share how often someone would take sepia for Sjogren syndrome?
It would be the same. So if you're using sepia for anything like that, you could still use it 200 once a week. It could be 200 a few times a week. Play with the frequency of it, but yeah, the same.
Okay, and just reevaluate after.
Yes.
Okay. Um, Next question is how about thinning hair and wrinkles?
Yeah, cell salts again. So these cell salts are amazing and beautiful. And I hope it's okay to say this here, Carrie, but I have coming up starting December 11th, every day at 12 o'clock, I'm going to release a new cell salt, and we're going to, for 12 days.
Yay, that is
We're
super exciting. Please share it with us.
absolutely, we're going to do the 12 days of cell salts.
I
And so you're
love
going to
it.
learn a lot about cell salts. So, okay, what did you say again? It's
Thinning
wrinkles.
hair and wrinkles.
Yes, thinning hair again could be silica, and wrinkles is one of the cell salts. Let me see if I can find it really quick. But you could also just do the bioplasma again for thinning hair, and then there is um, horsetail. What's the? It starts with an E. Does
Oh,
it?
I was gonna
No,
say Stiligo.
Ustalago.
Stiligo?
Ustalago. Yes.
Stiligo. Okay.
Yes, that
Yeah.
is known to really be helpful with
Is there a specific potency in that one?
let me see. This is where I should have been ready. Sorry.
Oh, that's
Um,
okay. What about while you're looking?
yeah.
What about sepia for thinning hair?
Yeah, so if especially if it's due to um yeah, my computer just doesn't want to do anything right now. So sorry.
It's okay.
Especially if it's due to hormones, which likely it is, then you would do sepia. Absolutely.
Okay. Otherwise, you would say go to the bioplasma.
Bioplasma. And we always want to get to the root of it, right, and fix it. So if it's hormonal, you probably want to do sepia and the bioplasma.
Okay.
And silica will really kind of concentrate on hair, and that can be too much hair growth or not enough. And right, so if you've got facial hair, it can be, and you're not supposed to, then it can be silica. Or if you've got thinning hair and your hair's falling out, then it can be silica also. But I would do sepia and the cell salts. And, maybe I can post in the comments when I can get my computer to help me know how much Ustalago to use.
Sure, that sounds good.
Okay.
And when you say sepia and bioplasma, do you mean take one, wait a few minutes, and take the other one, or just
Yeah.
put them all in your mouth at the same time?
Good question. Yes, thank you. So separately, so at least 15 minutes apart.
Okay.
So the sepia, you might be taking 200 once a week, and then the bioplasma, you might be taking 2 or 3 times a day.
Okay. Got it. All right. Next question. We've received questions about endometriosis and cysts on ovaries. What could you share with us about this condition, and would there be a different remedy if the cysts were on the pancreas?
So cysts, so endometriosis and ovarian cysts, the Banerjee protocol is something called con sepia. It's a mixture of 2 remedies. It's conium and sepia, and I believe it's conium 3 and sepia 6. And so conium maculatum 3C mixed with sepia 6C, and that's twice a day. And those potencies can be hard to find. So
We do have them at TapRoots.
awesome.
Yes, we do.
Wonderful.
Yes, we love learning these Banerjee protocols, and
Wow.
we grab them and put them on the shelf for people. So we have.
Very cool.
I've always called it conium. You said conium.
Yeah, I used to call it conium too. I think
Okay.
how people are.
I
Yeah.
want to say it right.
Yeah.
Okay. So you do have both.
And I'm in a London college and they say conium.
Okay.
So I kind of pick up on there how they say
Yeah, that's
things.
good.
Okay, so yes, that would be what I would do twice a day for and then if it sits on the pancreas, yes, that would be different and likely would need I don't know the Banerjee protocol if there is one, but if there's not one, then a consult would be helpful.
For sure. Okay. I was looking it up real quick in the Banerjee book, the part 2 book. They did mention if there's pelvic pain? Have you heard of Staphysagria 200 for that?
Yes, absolutely.
Okay.
Yes, good one. Yeah, that
Okay.
Staphysagria is great for all the pains down there for women. Yes.
Okay. All
Hmm.
right. Good to know. All right. Next question we received is, what can we do about Candida resulting from a virus? And if the Candida is shifting to another part of the body, like from a rash to oral thrush.
Okay. So we don't just as a little bit of teaching, it doesn't matter if it's shifting and it doesn't matter what caused it. Candida is Candida. And the protocol is Mercurius solubis, 200 twice per day, and which not mixed with, but separately from Calimure 3x or 6x twice a day. And Calimure is a cell salt.
Okay. I love that. I'm trying to type it in here for people as you're
Yeah.
talking. So that's good.
Yeah.
Thank you for that.
You're welcome.
All right, we're on question 9. We had a customer ask how to move through menopause graciously. What would be the best remedies to keep those hormones balanced through the process, and knowing when and if you should change remedies as your body changes.
Yeah. Ammonium carb is a great remedy for menopause. Sepia can also be really helpful. I wouldn't do both, just, do one or the other. I really love ammonium carb, and 200 every other day, I think is appropriate. But if you're having hot flashes with all these menopausal problems, then I would do ammonium carb, 200 every other day, and I would do sulfur 30 or 200 once per day.
Perfect. Okay, great. And what can be done for a prolapsing uterus?
That is sepia. Sepia will bring those things up. Prolapse uterus or bladder, anything that's falling down, sepia literally will pull it back up.
Is there a specific potency on that,
Same
or?
thing. Yep, 200 once a week or yeah, same. Hmm.
Okay,
I
good.
want to say, if you have another minute,
Yep.
hair. Oh goodness. Okay. Let me see. I thought I had it. Sorry. No, I don't. I'm just kidding.
We had our hopes up, but that's okay.
I will put it I found the wrong thing. I
A
will
little
put it
teaser. That's
in
okay.
yeah, that's right. Look for it. I'll do it.
Okay. That'll keep everyone coming back.
Yeah.
We do get a lot of women coming in here asking about thinning hair. So we would love whatever tips you can share on that. And
Phosphoric acid. Sorry.
oh, yeah.
Phosphoric acid. Yes.
Okay.
That's it.
200.
200. Yep. Once a day or every other day.
Okay, perfect.
Yeah.
And would you lean towards that one if you just don't know the cause, versus sepia if you think it's hormonal?
I would do both. If you think it's hormonal, because, well, I mean, what else? I don't know, honestly. What else could cause?
Mm-hmm.
I don't
Right.
know. I guess it could be an illness,
Mm-hmm.
if you're on some medication. So you
Right.
always listen, friends. You always have to look. If you're on medications, you need to go to drugs.com and look at all of the side effects.
Mm-hmm.
So if what you're experiencing is a side effect of your medication, then you need to target your homeopathy plan to getting off of that medication if you can, if it's possible. And you're going to do that along with your doctor. So if you're on a medication for IBS, and that side effect of that is heart palpitations, don't try to throw homeopathy at the heart palpitations. You can to help you feel better in the meantime, but you need to uproot that IBS. So you need to go for the gut healing. So get to the
Right.
root of it.
Exactly. Good. I'm
Okay.
glad you said that. Those were our 10 questions, but of course we did have questions regarding breast health, and I know that individualized consultations are going to be needed to address those specific conditions, but is there anything you'd like to add to that?
For breast health, yeah, I think that taking really good care of your hormones, knowing your family history and supporting your hormones with food and homeopathy is going to be the best kind of breast health. And not wearing a bra with an underwire, trying to get an organic cotton bra if you have to wear a bra. So if you can get away with it, and as often as you can get away with it, don't wear one. But I know that, some women literally they're too heavy. They can't do that. So breast health is an ongoing, food, exercise, take good care of your body, stress management. And then if something pops up, a lump, um, inflammation, anything like that, then we can treat whatever that is with homeopathy. Go get your thermograms once a
Mhm.
year. I know that you guys there, Carrie, have somebody come sometimes, or you did at
We
least
do.
once, and that's
Mhm.
amazing. We need to be watching for inflammation. Thermograms can catch that years
Mhm.
before any other test can catch it.
I'm so glad you mentioned that. We do. We have a thermographer come pretty much quarterly, and
Nice.
she's been booked up when she
Wow.
comes, so it's been
That's
a
awesome.
great success. So
Wonderful.
um, yeah, well, thank you for sharing your
Okay.
tips as always. Like I said, if you're new to homeopathy and need a starting place, we highly recommend the Gateway 1 course. Melissa
Mm,
offers this
yeah.
course as well as consultations for acute and chronic illnesses so that you're not alone. You're not trying to guess here. Melissa's website is melissacrenshaw.com. You can also find info about her consultations and classes there. And you can visit us online at taprootsva.com. You can sign up for our email list where you'll receive a 15% off coupon code that's redeemable on your first online order. Post any questions you have below. Remember, we're going to be talking about men's health next, so keep sending your questions our way so we have enough questions to ask Melissa. But like, comment, and share this video to spread the great news of homeopathy. We're rooting for you, and we'll see you next time.
Bye.
Bye.